Hello everyone, it is Dr. Nurse Tutor and I am back with another video. Now you see a question behind me, but I'm blocking the answer choices. The title of this video is Stop Depending on Multiple Choice to Answer Your Nursing Questions. Anyone who is reading nursing questions and depending on filtering through the multiple choice, you are doing a disservice to yourself and you run the risk of failing. Because they always tell you that there's going to be two that look like they could be correct, right? So why have to shuffle between those two if you already know the answer in your head? In my classroom, my students know I do not give them multiple choice. I just throw random questions at them. Why? Because I want you to be responsible for telling me the story. If I ask you a question or give you a scenario or tell you something's wrong with the patient, if you can tell me the story as to who it's happening to, how it's happening to them, why it's happening to them, and the things that you need to do, the nursing interventions that you need to put in place in order to take care of this patient, you don't even have to worry about looking at the multiple choice because you're going to lock the answer in your head. And once you lock the answer in your head because you told yourself the story, all you have to do is go look for the answer in the multiple choice. And you don't have to worry about being tricked about the different multiple choice answers because that's what gives you test taking anxiety. That's what trips you up. That's what makes you think that everything looks the same because you're depending on these multiple choice answers and they all look the same because a lot of times they're all correct anyway, right? So when you're able to tell yourself the story, it's hard for the multiple choice answers to trip you up because you already know the answer once you've told yourself the story. Now let's look at this question. It says the nurse plans care for a client with chronic obstructive pulmonary disease, COPD, understanding that the client is most likely to experience what type of acid-base imbalance. Now, if you know anything about COPD, COPD is a chronic obstructive pulmonary disease where the alveoli is hyperinflated. Your patient has the barrel chest, the patient has the flat diaphragm, everything is fibrotic in there. The alveoli, the bronchioles, everything is fibrotic. The patient is breathing in oxygen. But because the alveoli is hyperinflated, they have a hard time pushing off CO2, right? We breathe in the oxygen. We're supposed to expel that toxin, which is the carbon dioxide. But these patients have a hard time pushing off carbon dioxide, which causes them to trap carbon dioxide down in that alveoli. That carbon dioxide is a toxin, right, that you're supposed to expel once you breathe in oxygen. Now, when you're dealing with acid-base imbalances, you want to ask yourself two questions. Is it metabolic or is it respiratory? Metabolic would be a body system problem, kidney problem. Kidneys will start shutting down. Respiratory would mean lungs. The first thing you want to do is ask yourself, is this metabolic or is this respiratory? The question says chronic obstructive pulmonary disease. Even if you didn't know what COPD is, it says pulmonary in the question, right? Pulmonary means lungs. Automatically cross out metabolic. Metabolic would be a kidney problem. We're dealing with the lungs. Cross out metabolic. So both metabolic acidosis and alkalosis can go. Now you're left with two that kind of look the same. Respiratory acidosis, respiratory alkalosis. Now you have to figure out, is this an acidotic problem or is this an alkalotic problem? If this patient is trapping CO2, CO2 is a toxin. The body is running the risk of becoming toxic, which would be acidosis because we're trapping CO2. It cannot be alkalosis, right? Because yes, we're breathing in the oxygen, but we're not breathing it in at a rate to where we're bringing in way too much oxygen. Right? We're breathing in the oxygen just fine, but we're trapping the CO2. We're not even expelling the CO2, so it can't be alkalosis. We're not effectively expelling that CO2, but we're trapping the CO2, so we're trapping the toxin. Anything that's going to cause the body to become toxic would cause the body to become acidotic. So your patient would be respiratory, which is pulmonary because it says pulmonary in the question, and your patient is trapping carbon dioxide, which is a toxin, which will cause the body to become acidotic. The only thing that would make sense is your patient is at risk for running the acid-base imbalance of respiratory acidosis. Once you figure that out in your brain, you don't have to juggle with the answer choices because you already figured out, okay, you're trapping oxygen. That oxygen is turning into carbon dioxide. That carbon dioxide is a toxin. Pulmonary is respiratory, toxic, respiratory acidosis. Figure that out before you even go looking at the answer choices. That way you won't stumble with trying to figure out what the answer is. All right. So I hope this did help. This has been Dr. Nurse Tutor with another practice question. Stop depending on multiple choice. Tell yourself the story. All right. I'll see you guys again soon.